Hi everyone, my name is Ramandeep Kaur and today I am going to represent the topic named as Shortage of Nurses in Canada. Unexpectedly, Canada is experiencing scarcity of the nurses, causes of which are high workload. It is mainly related to COVID-19 pandemic as these kind of patients need extra care and that's why this situation put extra stress on the role of the nurses. The second one is legislative wage cap as a passing of the Bill 124 by the Ford government which put cap on increase in the basis for the workers who work in the public sectors at one annually for 3 years. The last one is incompatibility of the licensing criteria. Medical students who studied abroad they need to fulfill heavy requirements to get license to work as a registered nurse in their home country. Next are the solutions. The first one is involvement of the technology as technology make it easy for the nurse to do work at a fast pace and it will also saves time such a use of bunion network system by which a single nurse can handle care of 12 patients at the same time. In this she can keep an eye on the patients by using communication methods such as screening communication. The second one is prioritizing workplace culture means providing an environment to the nurses where they can feel supported, respected and they can feel free from the discrimination. This is also necessary to retain nurses in an organization. The third one is supporting nursing education as financial aid is required from the higher organization and the foundations to provide access of nursing education to everyone in this country. The last one is fast license tracking. It means making evaluation of study and other requirements needed to get a license very fast. The next one is expected outcomes as it contains two aspects study and act. In study, firstly, I am going to talk about the outcomes. It is expected that staff, by implementing solutions, staff burnout as well as turnover can be reduced up to some extent, which will further improve nurse-patient ratio and quality of care. Next one are the barriers. The first one is lack of staff training. Sometimes nurses feel it very hard to operate a new device because of lack of training. So it is very necessary to provide training to staff. The second one is resistance to change. Many people feel it hard to adapt new situation. It is also a natural phenomenon. So to overcome this is also necessary because this can act as obstacle to create a good working environment. The third one is poor financial support. Because of lack of resources to give education as well as to use technology in an hospital, there is need to bring resources with the help of organization and leaders. Next is the act. In this, I am going to start with the leadership style. It is expected that I will change my leadership style from the transformational to servant one because servant leadership style mainly focus on prioritizing the people as well as relationship as compared to transformational leadership styles which only focus on inspiring others. Next one is effect on the staff, leaders, client and family. It is expected that after getting proper support and care from the appropriate number of staff and nurses, everyone can feel satisfied. Even health promotion and protection can also be created for both family as well as client. The next one is sustainability plan. It includes open communication, which is also very necessary to create a good working environment because everyone can give their opinions in this kind of communication. The next one is assistance of higher organization as assistance from the higher organization is needed to take financial help to give access of education to everyone. Next is role of leaders. It is also very mandatory for the leaders to maintain well-being of the staff by providing them appropriate organization culture along with arranging funds for them needed to get education. And next, this is my reference slide, and this all about was my topic. And thank you.